Hello, thank you for joining us, everyone. We're going to just a couple of minutes here, let everyone come into the room, get settled before we kind of formally begin. While we're waiting for everyone to join us, just thank you all so much for spending your evening with us and spending some of your Friday with us. I'm sure you had long weeks with busy school days, so we really appreciate you spending some time with us. Again, we're going to wait just another minute or two here, make sure we have all of our students. Please feel free to go grab a glass of water, grab a snack or anything like that. Hopefully you're here to learn about all things pre-health at William & Mary. If not, you may want to check which Zoom you're supposed to be in. But we're so excited to have Professor McCoy with us. And again, we're going to wait just another minute here, make sure we have everyone before we kind of go ahead and get started. Just as a general housekeeping tip, we are recording today's session. So if you have to leave early or if you run to the restroom and miss something, don't worry, it will live on your welcome page in your student portal. So feel free to check back and study up or see if you missed anything there as well. Now that being said, it actually looks like our students have kind of slowed down a bit. It looks like we might have a majority of our participants today. So let me go ahead and introduce myself. My name is Christian Burnett. I am one of the assistant deans in the admission office, and I am very excited to be joined with Professor McCoy, and I will let him introduce himself. If you want to go ahead and do that, Professor McCoy.
Okay, good. Well, welcome everybody. I'm Professor McCoy. I teach in the department called Kinesiology and Health Sciences. And my classes I teach is human anatomy. All about the bones and muscles and hearts and brains and nerves and I teach a class called biomechanics, the mechanics of the body during movement. I've also taught statistics, and I'm in charge of the internship class too, where we get students out in the community and you get 3 credits for shadowing a doctor or a nurse or a physical therapist working in the clinic, and you can get 3 credits for that. So I coordinate that as well. So that's good. Okay.
So, and just so everyone's aware, during today's session, if you have any questions or concerns or anything whatsoever, please make sure to put those down in the Q&A box down below. Professor McCoy will be checking those as they come in and trying to respond to those, and I'll assist with that as well. But make sure you're putting that down in that Q&A box. If you put it in the chat box, we will not see it. However, at the end of the session, I'll be putting some helpful links in Professor McCoy's page and all of those types of things down there as well. But with that being said, I will turn it over to Professor McCoy and learn all things pre-health.
Well, thank you, Christian. I appreciate that. And keep me in line, Christian. Okay? just barge in and so that we can get everybody's questions answered, and hopefully they can learn something today. So that'll be good.
Yes, sir.
Let me share that screen and make sure it looks okay. There it is. Go to this. Does that look all right?
Looks good to me. Yes, sir. Okay.
Well, thanks everybody for joining in. We are going to learn about how to get ready for the health sciences. Hopefully this is the right webinar for you. The health sciences at William & Mary has become very popular. So we will, and so we're expecting quite a few of you to be interested in the health sciences. So this is a nice lecture just to get underway and maybe and answer your questions about what is the health sciences and how to get ready for it. So I'm Professor Ray McCoy in the Department of Kinesiology Health Sciences, and there's my email right there. So you guys are welcome to take a picture of any slide that you want so that you can have it on your phone. Or again, this is being recorded so you can look back at it as well. So we're getting ready for the health sciences. One little caveat there is we've asked to drop the kinesiology EM term, and we are soon going to be the Department of Health Sciences. So this is a great talk for us. We have about 12 full-time professors in our department teaching anatomy and physiology, public health, nutrition, and other physiology, exercise physiology. So just as an example, motor learning and motor control, how we control movement. So all of those are the courses that we teach within the health sciences. But I'll get over that, look over that a little more here pretty soon. let's go to the next slide. Okay, all kind of health science careers. So anybody interested in any of these? I hope so. And these are the type of careers that we're thinking about as far as thinking about health sciences and health science careers. So this is where our students go after they are done with William & Mary. They go on to grad school. Usually you need a grad school for these or a technical school for the cardiac and respiratory technicians, or other technicians. I just threw those two in, but there's other exercise physiology technicians. But these are pretty common places that our students go to after they graduate from William & Mary. At the moment, we graduate about 120 students per year from our department, and they go out into these areas. Good. Christian, I don't see the question and answer place at all on my box. So if they have some, I don't see it.
I'm not seeing any questions yet, but if they pop up, I will also pop back in and those to you.
Okay, good. Well, I wanted to check. Okay, good. All right. Okay, everybody, guess what? Everybody's going to ask, what college are you going to go to or university? And the next question is, what is your major? That is the second major question that everybody asks when you go to college. And at William & Mary, we want you to pause on the answer to that for about a year and a half. And we won't ask you to choose your major till the end of your sophomore year, because we want you to try lots of different classes, lots of different majors, and then choose your major that you want to be in. The other thing about William & Mary, it's a liberal arts school where we want you to be liberally educated in lots of areas. So the major itself is about 30 to 40 credits out of the 120 to graduate. And so, our majors are relatively small, so that then you can go out and take lots of other classes. You can take some more art classes and music and maybe even double major. There's time for double majors if you start as a freshman. So your major is not that important right away, okay? And in the health sciences, if you want to go on to some of those grad schools in health sciences, you can really be any major to go to these particular schools. So the most common majors are certainly biology, chemistry, neuroscience, which is a combination of biology and psychology, neuroscience, and then our department of Kinesis and Health Sciences and psychology. But you could be an English major, an art major, and go to med school. And so you can be any major you want, but these are the most common ones by far. If you're interested in physical therapy, our department is the most popular. Med school, more biology and chemistry, but we also have 30 or 40 of our 120 that graduate go to med school. So those type of things. Good. What's the most important thing? It's not what your major is. They really don't care about that. They want you to take the right courses and get great grades. And that's not easy to do, William & Mary. So give yourself a chance to succeed. So that's my quote I tell every person I advise. So you don't want to take 18 credits of physics and chemistry and biology. That's not giving yourself a chance to succeed. So make sure you take the right amount of courses per semester. And certainly your fall of your freshman year, start slow. 12, 13, 14 credits is enough so that you can get oriented to college and make sure that you get on top of things, get those A's right away. That starts out a great GPA so that you can continue it. Do not start with biology and chemistry and calculus the fall of your freshman year. That's a disaster. So give yourself a chance to succeed. Don't worry about what your major is right away. Take classes in lots of different areas, and then you'll settle into what you like and what your major is going to be. So that's good. I see a question and answer. I'm going to click on it and see what that says. Would the kinesiology and health science major also be a good option for students who are interested in dentistry? We have very few people that have gone on to dentistry. I think biology would probably be a little stronger place for you than our major. Yeah, good. Moving on. preparing for the health sciences. I have a slide for each of these areas, and to know then what courses you need to take in order to go on to grad school in each of these. I know you haven't even got into college yet, but we want to make sure that you are oriented so that you can get ready to get on to your next level. And so certainly you want to take the right courses at William & Mary. You don't want to be wasting any credits, as some people say. We don't want to do that. So I'm going to just briefly talk about each of these areas, and please ask questions along the way, for sure. So I'm not going to talk about every course within this, but just some general comments and some of the courses. All right, so if you want to get ready for medical school, there's a long list, isn't there? That's a pretty long list of courses. Now, you don't have to be a chemistry major or a biology major, but you see there is a lot of chemistry and biology there, and those are common majors for going into med school, but also the kinesics and health science is common as well, or psychology, right? But you will be taking these classes. There's actually the Gen Chem 1. You might have taken Gen Chem 1 in high school. You may get credit for that one already. Then you may come in and take Gen Chem 2, and then Organic Chem 2, and then biochemistry. There's 5 chemistries that you have to take. So you could be a chem major if you want, or you could be another major and be a chem minor. The chem minor is 21 credits, and so you have quite a few already here, 18, 19, 20, about 20 already. So it wouldn't be hard to be a minor in chemistry as well. I tell students, if they can be a chem major, if you can handle it and get A's and B pluses, then be a chem major, because it's hard. and it'll open the doors for a lot of things, med school, but other things as well. So that's cool. There's biology. That's the introductory biology in the fall. And then it continues in the spring as Bio 204. That class is okay for freshmen in the fall if you have had AP Bio and you did really well. If you have not had AP Bio and did really well, I would not take Bio 203 your freshman year. I would take some chemistry, but then take Bio 203 your sophomore year. You'll be a year older and you'll know how to do well at William & Mary classes, and you will just do better in that class if you take it your sophomore year versus your freshman year. A lot of people have thanked me for that advice right there. They see other freshmen in Bio 203 and Chem 103, that Gen Chem 1 too, and they have a lot of tears after the first midterms. So I recommend maybe starting with some chemistry, but do not start with Bio 203 unless you did really well in AP Bio. Then you're ready for that class. But there's other biology classes you could take. We have a class in our department, Kinesics 200. It's called Intro to the Human Body. So you can tell that Intro to the Human Body is an intro biology type of class. So that is a possibility to get you started. If you have not had biology recently, I probably would have you start that.
Professor McCoy, kind of while we're talking about AP credits and things, we did get a question asking, would you recommend using those AP credits if you're planning on going on to some form of medical school or graduate school, or maybe just talk a little bit more kind of about AP stance in general?
Heck yeah. You got those credits, use them, bring them in. All right, that way you can move on a little bit in your coursework if you can bring in those AP credits, for sure. The only little exception to that might be that biology class. Some people in the biology department say they really would like you to have Bio 203 and 204 at William & Mary, and that sets you up really well for the next biology classes. So see, if you get AP credit for Bio 203 and 204, and then you say, oh, I don't want to take them, then you jump into the higher level class. Of course, those professors think that you've already had Bio 203 and 204, and you might be missing out on a little bit. But the rest of the AP credits you might have, certainly I'd bring them on in, and that way you can use them, especially in psychology, sociology, history, all those kind of AP credits. Make sure you bring them in, so you don't have to generate 120 credits to graduate, so you'd be around 110 or even less than that. I've seen a student come in with 30 credits. And so they could skip a whole year. They could graduate in 3 years. And boy, that would save a lot of money. So I don't know why the college allows people to bring in so many credits, because they're losing out on tuition, but they do. So take advantage of it. So that's good. Any questions there? Yeah, another question, Kristen. What's that one?
I would say this one is asking more about the IB program with, do we offer credits for IB/HL subjects? And typically we'll accept, I believe it's just the 6 or the 7 on those exams will earn you credit for certain William and Mary courses. However, at the end of this session, I can put a link down in our chat box that has all of the different credit evaluations so that you all can see exactly what course it is, exactly what grade you need to get on that test, and what that will transfer into as William and Mary credit.
Good. I'm glad you answered that, because I didn't know what that was. So thank you. We didn't even have AP classes back when I took high school. So I just jumped right into Penn State with calculus and engineering courses. And that was a hard semester. I remember that well. So that's still more advice for you guys coming in as freshmen. Take your first semester a little light so you can adjust to the school. So that's good. Okay. Oh, I do want to mention at the bottom here, Professor Bev Scher is our pre-med advisor at the college. So we do advise within our department for med school, but she is the guru. She knows everything. So please ask her questions specifically about pre-med courses and getting ready for med school. So that's that. I wanted to have her name there to make sure you have that link if you need to ask very specific questions about getting ready for med school. So that's good. Any other questions here on med school? It's a lot. You don't have to take these all at once. Do not take physics your freshman year. Usually that's a junior year class. Let's see. And you see physics, it says 107, 108. That's for the health sciences. There's a lower number of physics 101 and 102. It's a lower number. You might think it was easier, but not. The 101, 102 in physics is for physics majors and chem majors. So 107, 108 would be the physics to take, but don't take it your freshman year. So that's good. You can take statistics your first year, math 101. I don't have written there, but it's math 106. It's a pretty easy math class to get started with. So that's good. If there's no other questions here, I'll move on to the next slide. If you're not interested in being a doctor, you might be interested in being a physician assistant. That's almost a doctor. And so you can take care of a lot of the common things within a doctor's office, colds and earaches and sprained ankles and cuts and things like that. The physician assistant will probably take care of that. And what's nice about physician assistant, it's only 2.5 years of grad school. That's it. And then you get to be a physician assistant. So that's why it's become very popular. But the problem with that is that it's very competitive to get into a PA grad school. So you see the list here is pretty similar to the med school, except, oh, there's only 2 chemistries instead of, well, maybe 3 instead of, yeah, you did the biochem. So 3 versus 5. So that's good. But the rest is pretty similar. They do add microbiology and genetics on there, but you won't be taking them as a freshman, right? You have to take Bio 203 and 204 first, and then you can have time for these 2s. And these ones over here aren't as hard. I'll just be straight off. These aren't as difficult. Psychology, stats, sociology, and a class that I used to teach, medical terminology. So those are classes. But look down at the bottom here for being a physician assistant. The grad schools ask you to already have had a job where you have collected over 1,000 hours of direct patient care. So that's not shadowing a PA. You should do that anyway, just to make sure that that's something that you would like to do. But they want you to have a job so that you're familiar with working with patients. As I say, it takes a lot of patience to work with patients. So you have to make sure you try that out. So most common that students do is to become an EMT in a fire station, a clinical nurse assistant in a hospital, clinical nurse assistant in a hospital or in a retirement home, or many other places really, or a medical assistant, someone who runs the office and gets patients ready for then to see the doctor or the PA. So look, that's a lot of hours though. So you have to think about that ahead of time. Maybe in your summers, you could then get an EMT certification and then work or volunteer to work or work in EMT or CNA. I like CNA the most and then CNA in the hospital, because then you get to be there in the hospital working, they'll pay you, and you get to see what the doctor does and the PA, and then the nurse practitioner and the nurses, and then you're helping the nurses. So I think it'd be a nice job to be in the hospital so that you can see what everybody's doing. Then you can make a decision whether you are fit to go to med school, or you would rather be a physician assistant, or you'd rather be a nurse. So those are all things that you can do. Let me click on the Q&A up here.
I would say it's a question based off of kind of internships and clinical experiences. So maybe we can touch on those after we kind of finish going over the different pre-health disciplines.
Yeah, that'll be fine. Good. That'll be fine. Let's move on to the next layer then. Physical therapy is the area that I started advising in first, and then we moved into these other areas. But physical therapy, and certainly our department would be the best department for getting ready for physical therapy. You see a similar list, but there's only 2 chemistries, and it could be Gen Chem 1 and Gen Chem 2, or it could be Gen Chem 1 and that Orgo 1 as well. And there's the Bio 203, 204, or some other biology courses. We could talk about that individually, but they kind of really want you to have 8 credits of bio as an introduction. So the Bio 203 in a lab is 4 credits, so that makes 8. Yeah, so that's probably the best thing. Those classes are hard though. So it's hard. It might be hard to get a C or a B, or definitely hard to get an A. So sometime if you talk individually with me, we might suggest another bio or 2 class to substitute for those. For PT, for med school or PA, you have to take Bio 203 and 204. So there's my anatomy class there, and there's our physiology class. And then we have physics, lots of psychology, always statistics. Humanities or some of the ethics courses, and then 2 other English courses. Now these 40 hours at the bottom, they are to shadow a physical therapist. So get into a clinic and help out the physical therapist, and just to be there enough so that you can see whether that is what you'd like to do or not. Yeah. So they used to make that 100, so they've decreased that over the years, just because the clinics are getting kind of busy. So. Good, that's it. Any questions here? Physical therapy, a lot of people interested in PT will come into our department. And now the most important thing for you really is what classes are you going to start with in the fall? And I'd probably start with the chemistry, maybe not the bio, and then not anatomy, not as a freshman, just too big of a class, just takes lots of time. And I'd recommend for your sophomore year, your anatomy and physiology your sophomore year. Yeah. Good. I'm just trying to think of things that are common that students tend to ask me. And just to get started, I'd start with some chemistry and then just reach out. What is anthropology? Maybe take a class in anthropology or sociology. Definitely, psychology. It says Psych 202. There is a Psych 201 introduction, but it's not the prerequisite for these advanced ones. So this one is the prerequisite for these advanced classes. So if you're taking a psych your freshman year, take Psych 202, and then you'll be ready to take developmental psych or abnormal psych later. So that's a circle that one. That's a good hint there if you're going to be at William & Mary. Good. Occupational therapy is similar to physical therapy. They are very similar careers. I'm surprised that the exact list of prerequisites aren't identical because the careers are very, the occupational therapist will work more in a hospital and then outpatient within home on OT. And then in the school system too. Some of you may have seen an OT at the school helping students with maybe their speech or their walking abilities in schools too. So occupational therapist. So occupational means that it helps people with their daily living tasks, whatever their occupation is, a student or an adult. But but it's all very physical. So it's very similar to physical therapy. And we see that they don't ask any chemistry, and I don't know why, but they don't. So this one's just a little easier to get ready for versus the physical therapy. So yeah, you might be saying like, I don't know well, I don't know whether I want to be an occupational therapist or a physical therapist. Well, I tell everybody comes into my office, go shadow these professionals at least 1 day or 3 days or 4 days so that you can really get to see what these careers are really like. It's not that you're just a patient for one of these careers, but you really need to go shadow the professional so that you can get to see what it's like when you're there. So that's my big advice. Make sure you go start shadowing. The best way to get a shadowing experience or this internship experience is to know somebody. All right, use those connections. Your uncle or aunt might be a doctor, or somebody's a doctor or a nurse or somebody in a clinic, and they can hopefully slide you in so you can have some observation hours in each of these different types of careers. Good. Christian, what's the questions we have? Anything we should talk about now?
I would say we're getting more questions just about what specifically William and Mary does to help its students find those internships and to find those observational opportunities.
Yeah. For physical therapy, I know of 11 clinics in Williamsburg. And they all know William and Mary students are coming to them. So that's a pretty easy one to get some, shadowing hours or internship hours. So that's easy. Occupational therapy, a little harder because we're not allowed in the school systems. And so there's some outpatient home study occupational therapists that I know of. And there is a place for children, or preschool actually, is there's one in a little city near Williamsburg called Toano. And there's an occupational therapy clinic out there. Some students have gone there. But the med school and the PA, most students do those shadowing back home over the summer. So I don't have those connections at places outside of Williamsburg. But in Williamsburg, when you're doing your regular semesters, you usually are too busy. but we can reach out to a few places in Williamsburg to help you with internships. So, now with this COVID virus, of course, everything's been shut down. So it's been very difficult lately, but I'm sure once everybody gets vaccinated, I think that'll open up again to be back to normal for getting those shadowing hours and internship hours. Yeah.
And speaking more on those and specifically some of those ones that may not be Williamsburg based, all students, regardless of year, are more than welcome. In fact, they're encouraged to go visit our Cohen Career Center. And Cohen can definitely help match students with, they have databases on databases of all sorts of different employers or internships that William and Mary students have worked with previously, or maybe William and Mary alumni. So they can also really help link students to those opportunities, both in Williamsburg and in the greater community and across the country as well. So just a little plug for the Cohen Career Center real quick.
Yes, I totally recommend that you go see them as freshmen. They want to see freshmen, not just seniors who want a job, but as freshmen to get in there and get them to help you decide where your interests are, and then maybe hopefully some shadowing experiences within those interests. And then you can say, yeah, I really love that, or, oh, that's not what I expected. So you need to get into those shadowing or internship experiences as soon as you can so that you can find that information out. Yeah, very good. someone asked the question is how many, do we know how many people drop out of pre-med? And you know what I see? I see students after their first year or two says, I thought I was I was pre-med and I thought I was gonna want to be a doctor, but now I think I'd rather be a PA, or I'd rather be actually even a nurse and take care of people more than just zip in and zip out with the great knowledge that doctors have. I don't want to diminish doctors at all because they're awesome. What they can do is phenomenal. So if that's where you want to be, that's wonderful. But some people, after they shadowed and volunteered, they realize that they might like to be the PA or the nurse or occupational therapist or PT. So these are similar careers because they're helping people get better. And you just need to know where you fit within that. So,
and kind of talking more about dropping out, can you explain or kind of detail a little bit more about how at William and Mary it's an advising program and not a set track or a major that a student would then select?
Yeah, very good. Yeah, we started off with that back there a little ways, the second slide or so. What's your major? And realize we don't have a major called med school or pre-med. We don't have a major called physical therapy or occupational therapy. So you'll pick your own major, and then through our advising, we will get you ready with these classes and your experiences to get ready to apply to graduate school. Yeah. So yeah, you're right. People do email me and ask if they want to be a PT major. Well, you can't be a PT major at most any universities, really, until you get to grad school. Then it's a graduate degree, not an undergraduate degree. So that was good to specialize in that. In fact, here's my last slide of information. Ooh, it kind of got cut off at the top. Can everybody see what it says? William & Mary does not have a nursing program. So people say, I'd like to have my major to be nursing. And unfortunately, we do not have a nursing program at William & Mary. So you would go through your normal major, biology, neuroscience, or psychology, and you would do your shadowing and internships and in nursing, make sure that, yep, I definitely want to be a nurse. And then you would complete your William & Mary degree. And then you would have to go to another university and get a second bachelor's of science in nursing, or your BSN, Bachelor of Science in Nursing. And that takes an additional 1 to 2 years. So then you would have 2 bachelor's degrees, and then you'd be a nurse. You could get your RN, your registered nurse certificate at that point too, so you could be a nurse at that time. So since that second bachelor's is an add-on type of thing, it only takes 1 to 2. It wouldn't take 4 more years because you've already done a lot of your general education requirements. But then these are the classes that you should have to get ready to go do what's called an accelerated BSN nursing second bachelor's degree is what it is. So my last comment, Kristen might not like me saying this, but if you really, really want to be a nurse, okay, you could go to VCU or ODU down in Norfolk, and they have a major in nursing, and you could get your nursing degree in your undergrad your first 4 years of undergrad. So you could cut out this additional 1 to 2 years after William & Mary if you got your degree at a different university. Now, we're not encouraging you to go somewhere else, but if you were set on being a nurse, I would think heavily of maybe thinking about another school just so that you could get your nursing degree in 4 years instead of 6. That of course saves you time and tuition. So, but now if you are William & Mary, you want to be a doctor, and in your junior year, you say, oh, I really want to be a nurse instead, then you would, of course, at that stage, you would finish your William & Mary degree, and then you would go on to an accelerated BSN degree. And we've had students do that, of course. In fact, more commonly, it's gotten to be more popular to do this accelerated BSN at VCU or let's see, VCU, out at UVA as well. So there's places to get this accelerated BSN so that you can be a nurse. And then most students actually don't stop there. Then they continue to become the nurse practitioner. So that's a graduate degree in nursing called the nurse practitioner. They're very similar to the physician assistant as far as their level of care. And you see your own patients and you can do prescriptions for certain level of drugs. So the nurse practitioner and the PA are similar as far as their job goes. So that's something, but then the physician assistant is quicker because it's just 2.5 years after William & Mary, and then you'd be a PA. So this accelerated bachelor's degree and then a master's in nursing is a little longer, but quite frankly, it's a little easier. So some students who don't have the highest GPA, they go the nursing route and then they go on and get their nurse practitioner degree as well. So there's different ways to get where you want to be. And I just want to encourage everyone to, of course, you're going to work hard at it, but if you get a C or maybe a D, don't say, oh, I'm done. I'll never go to med school or I'll never go to PA school. That's not the case. It means that you'll have to certainly take that class over again and then show off to the grad schools that you can get an A or a B. But don't let people discourage you if you do get a low grade now and then, especially that freshman year. Every senior says, I'd have a great GPA except for my freshman year. So because it is a big adjustment to get to college and to study a little more independently on your own. You really got to crack your own whip and to make that happen. So just don't get discouraged if you do get a low. I know all you guys are all AAA students right now and never could imagine getting a B, but I want people to get a B that first year because that breaks that mold of getting all A's. Okay, get that B and say, oh, that life's not going to end with a B. So you're going to keep going, and even a C, but you can't have too many C's. But just realize that it's okay to get a B at William & Mary. Our classes are definitely a little tougher, and we want you to think hard. So we make it a little tough, and that's going to make you a lot better whenever you get into grad school and you're compared to all the other people that went to other schools. I won't mention any names, but you will rise to the top. We see it all the time. And a student came back from one story here. A student wrote back after he's in med school. I forget what med school is, but it had 250 students in their med school class. That's a huge med school. And he wrote back and he got the highest diploma for his dissection in the cadaver anatomy lab. So maybe that's because he was a teaching assistant in our cadaver anatomy lab. So one of the special things about William & Mary is in the anatomy program, we actually have cadavers in the lab where they've donated their bodies so that we can learn from them. And we do. And the students do all the dissecting, open them up and see where the muscles are and the arteries and veins and nerves. And we invite some seniors back that did well, and they are student assistants in the lab. And that's what this gentleman did. And it really prepared him for med school. And then he was the top out of the 250 med students. So we thought that was pretty cool. So that's good. That's even on our website. You go to our department website, his story is there. So I think that's my last slide. I think my next one is all about questions. Yeah. So are there additional questions there, Christian?
Yes, sir. Looks like the first one is, are there hospitals or local clinics near William & Mary that students could shadow at during the school year? And you definitely touched on that a little bit. Feel free to maybe list a couple of those other clinics or hospitals that students might frequently work with.
Yeah, in Waynesburg, we have two hospitals that fight over patients, the Riverside system and then the Centera system. One built a new hospital, so the other one built a new hospital, and about 10 years ago now. But And so there's opportunities to shadow in each of those. I think Riverside has been a little more open for William Mary students than Centera, but there's been people in both there, as well as other office clinics where we've been able to have students shadow. But by far, the best way to get shadowing experiences is to know somebody, a relative, or even your own doctor. You know, if you've been your own doctor back home, go to them and say, I'm a William Mary student now, I'm interested in health sciences. Could I shadow you in your office? And those connections mean a lot. And so that's the easiest way to get an internship. Yeah. But I can help you mainly with physical therapy and a couple occupational therapy. I could help you there in those areas.
Looks like we're also getting we've gotten a couple questions specifically related to dentistry. And while Professor McCoy is certainly able to talk about those, I would also encourage all students that are thinking pre-med, pre-dentistry, pre-vet, or pre-pharmacy. We actually kind of split those up here at William & Mary between pre-health and pre-med, pre-vet, pre-dent, and pre-pharm. Definitely check out that other session. It's recorded and it should be available on your welcome page soon. But they talked a little bit more about the dentistry and the veterinarian sciences. So please feel free to check that out as well. But Professor McCoy, specifically, do you want to talk about maybe some accelerated programs or some early assurance programs that William & Mary sees students apply for?
Yeah, yes, I can. They're not in the dental area, though. I'm not familiar with those. That's where Bev Scher, I mentioned her name before under the med school page, but she will know more about dentistry than I do. What was your other question? Was the early assurance programs? We have
Yes, sir.
set that up for EVMS, that's Eastern Virginia Medical School. It's down in Norfolk, and we have a early assurance program in the med school for med students and in the PA program. So what that means is that if you do really well, your freshman, sophomore, and beginning of your junior year, and you have really good grades, then you can apply to those schools and they will accept you after your junior year. So that's an early assurance program. And so then you know you're in. That's awesome. And they know that they got a great student there. So they like that too. So, and then you'd finish your year at William & Mary, your senior year, and then you would wait a few months, and then you'd go into med school or PA school at EVMS. Yes. So yeah, I help to coordinate the PA program, and Bev Scher, Professor Scher, she does the med students for that early assurance program. Good.
Awesome. And then our next couple of questions are really related to research and research in kinesiology and in the health sciences. Maybe talk a little bit about what that process looks like in terms of coaching professors and then joining those labs.
Right, good. Research is not a requirement to go to med school or PT or OT, but it's interesting and it's fun, and it does show off a little bit about your advanced knowledge so that you can be involved in a research setting and you can help those professors do their research. And since we have so many good undergrads, we pick the best and we allow them to help us with our research, and then they get on publications. We put the undergraduate names right in the publication listing. So you would be a published author for those research articles. In the health sciences, that you could be, and again, in the biology department, they have about 30 professors in biology, and psychology has quite a few, over 20. And then we have about 12 or so full-time faculty. And we all have to do some research, and we always pick about 2 or 3 students to help us with our research. Sometimes even 6 or 7 or 8 students per semester. And then you can help with that research. And sometimes you're just doing a simple little job, but that's okay. That's a way to start doing research. You have to start somewhere, and then you can add like 1 credit of research your freshman year, and then you can add on 2 and 3 credits over the years to come. So it is good. Now, again, each professor can only take a couple, so it's not for everybody. Sometimes research gets quite boring. You do the same job over and over again for hours on end. You have your headphones on, of course, and do things, but in the long run, you can get on those publications, and that really helps your resume, and it does help you get ready for your next level in grad school. Yeah, for sure. Now, the best way to get involved in that is to take a class from a professor, get an A, and really be interested in that class, and then talk to that professor and say, wow, that was really interesting. What research are you doing that is similar to this class? And I'd like to help you. And they say, oh yeah, I know you from my class. And yes, I would love you to help in my research lab. So that's probably the best way to get in. You can just look through the website and look at all the professors' research, and then pick one that you're really interested in, and then contact that professor and set up a meeting, and then you can ask them, what research opportunities there will be. But do realize that most professors only take in a couple students at a time, so it's a little competitive there.
And kind of while we're talking about research, just as a general statistic for everyone, about 80% of William and Mary undergraduate students do some kind of research before they graduate.
Wow.
Actually starts in your very first year. You're going to take what we call a college curriculum course called Call 150. And that really introduces you to research at William and Mary. You'll learn how to use the research databases and the library system. You'll learn the various steps and methods of the research process. And it'll also just kind of teach you how to prepare a research paper, an abstract, an introduction, a works cited page, and all of those types of things. Mm-hmm. So research is certainly a huge part of life here at William and Mary. And like Professor McCoy said, the labs can be a little small. However, almost every single lab has a waiting list. So if a student leaves that lab, or if a student graduates, the professors are able to then pull students from that wait list into their lab. So yes, there's a question in here about, is it, are you able to? And yes, pretty much any student that wants to do research will get to do research. It may not be your first choice, but you will have that opportunity during your 4 years here. So just wanted to give that little disclaimer real quick. Our next question is kind of asking for just a general description of how science or health science classes work at William and Mary. Are they lecture-based, discussion-based, built-in labs? Just kind of maybe an overview of what the average science or health sciences course might look like. Mm-hmm.
Yeah, very good. I guess the first answer would be all of the above. So, I mean, your freshman year, you may have a little bigger classes, right? My anatomy class, usually your sophomore year for anatomy, and it has 110 students. But I like to be in front of everybody and talking. We have discussions during that lecture. It's not just me straight lecturing with no questions at all. So almost all professors are very good at getting interaction with students. And so it is a lecture hall for some of the big classes, but there is always interaction going on. And those big classes almost always have breakout sessions we call discussion sections or labs, which then those will be 15 students with either a professor or with a grad student to, again, to go through more discussion and particular labs, lab events, so that you can do things each week, which adds on to the lecture material for sure. And then after your junior and senior year, those classes then get smaller down to the 25 or 30 size in our department anyway. I know in other departments, the classes can get down to 8 and 7 and 10 students for a professor in a class. But in our department, we're sticking 50, 40, 30, because our health science area has gotten so popular lately. But and we have a couple ethics, ethics classes where you discuss ethical considerations. Well, you have to discuss it. So we limit that class to 25 so that there can be discussions going on in the class. And that'll involve some short papers, 3 and 5 page papers, so nothing major. And then maybe a 10-page paper at the end for that type of a class. As I mentioned before, I coordinate the internship classes. So, and that's where you're out doing things with professionals. Our requirement is 90 hours with a professional. And then that'll give you your 3 credits. But in addition, we will have you write a 10-page research paper. And so that's reviewing research literature on a topic of your choice, and then writing that up, and so that you become the expert in that area, because we want you to look at papers within the last 8 or 10 years. So you have the newest information on that topic, and write that all up, and then you can present that to the professor. We also have a place where you can turn that into a PowerPoint slide and presentation, and then present it to at our kinesiology research symposium at the end of the semester. And you will present your paper as a presentation, and then students and professors will ask you questions about it, since you're the expert now, and you may or may not know the answer. It's totally okay to say, that's a very good question, but I didn't look into that area, because you can't be expert in everything related to that topic. But those research symposium has been a delightful exchange of ideas and discussion of all different types of topics, physical therapy topics, anatomy topics, but public health topics, especially now with the COVID virus and all. We're going to have lots of public health types of interest. So those kinesiology research symposium is a wonderful way to exchange your ideas and from your paper, and then exchange it and have a great discussion between students and faculty. We're all very friendly. There's no one's going to criticize you. Everybody is just really curious and want to know more, so they'll ask you questions. It's a we're surprised how wonderful it has turned out. We do it the last week of every semester, where you present your information that you've acquired through your paper. So that's good.
And while we're talking about research, April is actually Undergraduate Research Month, and William & Mary is doing a lot to celebrate that. So if you are interested in research, again, check through the rest of our admitted student programming. We had a session with the GEO, which is one of our largest research labs on campus, but there are multiple other research discussions happening throughout next week. So be on the lookout for those as well. I'm not seeing any other questions in the Q&A, so if you have any others, please sure to put those in there. But while we're waiting to see if we get any more questions, I'm going to put a couple helpful links down in the chat box. So not the Q&A, but in the chat box. And I've been putting a couple things in there. So there's already something in there about credit evaluation and AP scores. And I also linked and gave you all Dr. Scher's email again. So if you have any pre-med, pre-dent, pre-farm, or pre-vet questions, please feel free to reach out there. Next thing I'm going to put in is to learn more about pre-health. Please go see Professor McCoy's page. It links to not only his pre-health advising opportunities and information, but it also links to some of his research interests. So if you want to check out what Professor McCoy specifically is doing, please feel free to do that. That I'm going to put in here is actually a link to our Meet a Major page. This is a great way to get a direct student perspective. You can chat and email back and forth with a current student from whatever major or discipline you might be interested in, whether you want to ask what's your average homework load like, or maybe you want to know more about the clubs and organizations within that major. Feel free to utilize that page. Then the next,
Christian, I'm gonna jump in there and just applaud
yes,
you. on
sir.
Just applaud you on doing that. That's a wonderful idea. So students should really take advantage of that link up. We've talked about it in our department for years and we just never got it underway. So having a mentor type program where students can ask, you know, upper level people who are already majors all about that major and, you know, what professors to take and which ones to stay away from. And I'm teasing. But that's a wonderful idea. So thank you for doing that.
No, and I believe I'm checking right now just to make sure, but we have, let's see. We have two different students there. We have a current senior, and then we also have a junior that are helping us answer those questions. So feel free to reach out to them specifically in kinesiology and health sciences. And then the next thing I'm going to put in here is a little more general, and that's going to be the link to your welcome page. So in your student portal, this is the link to see all of our admitted student programming and to register for all of the events we have coming up. Not only are they academic based, but we also have a lot about campus resources and student life. So definitely make sure you're registering for all of those. That's also where your the recordings for all of these sessions are going to live as well. So if you missed anything or if you want to go back and check or re-listen, feel free to head there. And then the final thing that I'm going to put in here is the link to your activate and deposit page. So if you've decided that William and Mary is where you call home, is where you want to be for the next, 3, 4, 5, 7, however long you want to spend here. Hopefully no more than 4. But whatever you decide to do, that link is now available for you all as well. It looks like we do not have, actually, I think I just answered this question. So we're going to post the recordings from this weekend. So all of those will go live over the weekend. So you'll be able to access them then. There's a bit of a delay just so that we can make sure we transcribe them and do everything appropriately. But thank you all so much for spending your Friday evening with us. We really appreciate it. If you have any questions or concerns whatsoever, please feel free to reach out to these professors you see here, but you're also more than welcome to email admission, and we will make sure that if we don't have the information, we can route you to someone who does. So I just put our email down there below. But thank you all for joining us, and a virtual round of applause for Professor McCoy. And thank you, Professor McCoy, for spending your time with us. But with that being said, you all are free to go. Please enjoy your evening, enjoy your weekend, and fingers crossed, hopefully we'll be seeing you on campus in the fall. But thank you all. And again, have a great night. And we look forward to hearing from you soon.
Thanks, Christian.
No, thank you.
Bye, everybody.